The unpredictability of those numbers means hospitals need to be ready to deal with a changing patient load and staffing issues.
News Center Maine's David Guilford explains how science and some tough realities are shaping how hospitals make those decisions.
They've been frustrated because they've been stuck at home. And we've, of course, had the challenges of staffing.
MaineHealth, the state's largest healthcare system, changed its policy late last week, so staff no longer need to test negative before returning to work after recovering from a COVID quarantine. Chief Government Affairs Officer Katie Fulham-Harris spoke to the state health department on Friday.
The testing is very good at diagnosing COVID. It is not very good at identifying whether someone is able to transmit COVID.
MaineHealth confirmed Monday its hospitals remained in contingency status, meaning resources are stressed but not to a crisis level. Testing to return to work was not required by CDC standards. A MaineHealth press release said science as well as a short supply of tests led to the decision.
We're using all the levers we have to try and increase the size of the market.
Last week, the Biden administration announced it was buying 500 million more tests to distribute to Americans. Dr. Tom Inglesby, the White House's COVID testing coordinator, spoke with our Chris Costa on Friday.
There are lots of different modalities for testing. Over-the-counter tests are a really important part of that, but they're not the only way to test. We have laboratory testing, point-of-care testing, and we're going to keep promoting all of those channels as well.
Maine's second largest healthcare system, Northern Light, is also in contingency status but has kept its testing requirement in place.
It's just a tough time right now.
As individual hospitals make their own decisions within federal guidance, Dr. Lori Banks with Bates College spoke with us Monday, saying testing requirements were initially part of the CDC's plan, but health leaders realized it wasn't a reality.
Access is an issue right now. And so it just wasn't even feasible to include. So again, in a perfect world, if everybody had unlimited testing available, they'd be able to include that, but we don't. That's the hard part.
In lieu of a perfect world, Banks and Maine's hospital leaders are hoping for a more vaccinated one, so its nurses and doctors can keep caring for the rest of us. David Guilford, News Center, Maine.